This is the subacute treatments for prepatellar bursitis, consisting of days 3 to 4 for the starting point and going through day 10. We'll continue to manage pain with electrical stimulation, such as interferential current, around, as previously stated, the quadriceps, the pes anserine, and the tibialis anterior, just crossing that whole knee joint, as well as with cryotherapy, preferably post-exercise or post-treatment. And a new addition we'll do is thermotherapy to increase blood flow to the area for that nutrient delivery throughout the subacute treatments. This can look like a hot pack. This can also look like a hydroculator hot pack, or even warming up on a stationary bike. I'll also, one of the first things I'll add is some joint mobilization, specifically of the patella. I will state that my patient would have shorts on for every treatment so that we can actually evaluate the knee specifically and see what's going on. We'll start with some joint mobilizations of the patella, moving medially and laterally. We want to keep that motion and keep that fluidity of the soft tissue there, even up and down, superior and inferior, as well as any tilting, medial tilting and lateral tilting. Additionally, we'll move on to some range of motion. So I'll have the patient scooch to the edge of the table with their legs hanging off. We would begin passively and perform all the movements of extension, flexion, internal rotation, and external rotation. For the purposes of this video, I'll show you the active range of motion that we would do second. So there's extension, scooch out just a little bit more, and pulling back would be flexion of the knee. I'll give a stool to the athlete for internal, perfect, and external rotation. From there, we'd move on to some more strengthening and resisted range of motion. I will say specifics in the next video. We will start with that open chain going to closed chain. Additionally, if you go ahead and lay back all the way, we'll move on to some proprioceptive work. And so one idea that is good for foundational quad strength is I would have the patient close their eyes, the athlete close their eyes, tap the quad, and as I tap it, they would extend and push their knee into the ground. And when I tap it as fast as they can, kind of rotate that down. Another one they can do, scooch towards the edge of the table for me. I could tap the front of their shin, and they would extend that leg out. I could tap the back, they would flex in. I could place them on a stool just like so, tap the inside of their foot, rotate in, tap the outside of their foot, rotate out for those proprioceptive taps. Additionally, with range of motion, we move on to from that closed chain to open chain into more sport-specific and game speed, game style type things. This is it for the subacute treatment phase.